Assalamualaikum doctors. In this video, I am discussing about Charcot Marie tooth disease. So, Charcot Marie tooth disease is common in neurology, lower limb examinations, or it also comes on development. Charcot Marie tooth disease. Look at the picture. Some features I am telling. First of all, the lower limb they are showing that is so much wasting, like wasting, and the leg you are seeing it is called pes cavus. This sign pes cavus. Claw hand. The hand are claw hand. This is that is a like champagne bottle. And another thing is that they have can be special shoe present, and their gait is high stepping gait. So first I am telling about high stepping gait something. Description is knee is high than the toe, touch the floor fast than the heel. It's like a march gait. Normally the heel touches the floor fast than the toe. The difference between is a toe walking is that in toe walking the heel not touch the floor. Okay, so it is one kind of toe walking, but toe walking not heel touch the floor. The DD, it also comes on video station high steppage gauge. DD are bilateral and unilateral. Bilateral cause are GBS, Charcot Marie tooth, peripheral neuropathy due to vitamin B12, diabetes mellitus, thyroid, drugs like vincristine. And the unilateral are spinal cord tumor, nerve injury, fibula fracture, peroneal nerve injury, and trauma. So bi and uni, GBS, Charcot Marie tooth, peripheral neuropathy, vitamin B12 deficiency, diabetes mellitus, thyroid, drugs like vincristine. Unilateral are trauma, tumor, spinal tumor, peroneal nerve injury. So Charcot Marie tooth disease, that is a hereditary sensory motor neuropathy. General observation, what we find, mentality may be affected or not. Staccato speech and nystagmus. They have nystagmus, we know, eye issue, and the staccato speech. General examination, when we start, what we find, lower limb there is a special shoe, pes cavus, wasting in the distal muscle giving the shape of inverted champagne bottle. Upper limb claw hand due to the wasting in the small muscles of the hand, Charcot arthropathy with hyperextension in metacarpophalangeal joint and flexion of the interphalangeal joint. Okay, the high steppage gauge. So proceed to the Romberg positive and ask him to sit from position, from standing positions. Only posterior column affections, so no ataxia. Postural scoliosis and kyphosis with the advanced age. So scoliosis, kyphosis also present. Now I am going the local examination. What we find, decrease the tone, power and reflux. Distal is more affected than the proximal. Maybe preserved knee, negative Babinski. Normal sensation, impaired the proprioception and vibration due to the posterior column affected and deep sensation. So I'd like to complete my examination, full neurology examination, developmental assessment, upper limb examination, because claw hand we find. What investigation we do? They ask how can manage. So diagnosis is genetic testing. It is an autosomal dominant condition. Chromosome number 1 is affected, but multiple inheritance mode present. Now conduction velocity severe showing in conductions, severe slowing. Nerve biopsy show onion bulb, remember onion bulb, and the radiation X-ray of the spine for scoliosis. So we do genetic testing, nerve conduction study, nerve biopsy, and the X-ray, radiology X-ray of the spine. Treatment is first of all stabilize the ankle joint with ankle foot orthosis. So supportive device we give phenytoin and tegretol for burning sensation, and the physiotherapy. Treatment we are involving neurology, physiotherapy, occupational neurology, physiotherapy, occupational therapy, orthopedic for joint stabilizations, genetic counseling to the family, lies with the school, and psychological support. And the other causes are like neuropathy, diabetes mellitus, hypothyroidism, vitamin B12 deficiency. So this is Charcot Marie tooth disease. Thank you.